Over half of the respondents surveyed in a recent Gallup poll indicated that they worry a great deal about the availability and affordability of health care. Healthcare topped Gallup's list of potentially worrisome issues for the fifth year in a row. Out of 1,039 American adults, 55% said they worry a great deal about healthcare affordability and healthcare. About 25% indicated a fair amount and 21% stated only a little/not at all. According to the Gallup poll findings, a majority of Americans have said they worry a great deal about healthcare in each of the 18 years the question has been asked since 2001, more than twice as often as any of the other 12 issues most often measured. We're not surprised at all, Frederick I. Zassi, Executive Director of Families USA, told Newspulse Finance. We've been hearing a lot from our state leaders, consumer leaders, and from the public about this, and the statistics are pretty startling. Over the last 40 years, we've seen a six-fold increase adjusting from inflation. We're spending 6 times more as a country on healthcare than we did 40 years ago. In 2017, U.S. healthcare spending grew 3.9%, reaching $3.5 trillion, or $10,739 per person, according to the Centers for Medicaid and Medicare Services, CMS. That accounts for about 17.9% of the nation's GDP. And the number of uninsured Americans rose from 27.5 million in 2016 to 28.9 million in 2018, according to a recent report from the Congressional Budget Office. We have to acknowledge that in the country right now, and the irony of it all is that we're spending 2 or 3 times more than other wealthy nations per person for our health care, Zassi said. Our families are struggling just to see the doctor pay for their medications. In that sense, the system is absolutely broken. The Affordable Care Act, ASAI, signed into law in March 2010, aimed at reducing health care costs and providing health care on a national level. Nevertheless, healthcare worries have still remained relatively unchanged since then. My sense is that the ASAI had some impact, but not major, David Cutler, a professor of economics at Harvard University, told Newspulse Finance. 2 sorts of people got cover. One is people who were on Medicaid, and those people really have significant needs, have their bills covered, and are probably less concerned, and then, there are the people who are in the insurance exchanges, and those folks now have insurance. They may not go bankrupt, but their deductibles are still very high. Worry is perpetuated by uncertainty surrounding the ASAI. In December 2018, a Texas judge ruled that Obamacare's mandate was unconstitutional and agreed with the plaintiffs who argued that the lack of a penalty invalidated the individual mandate provision of the law. And if that part of the law were to be invalid, then the whole law would be. In the meantime, Americans are turning to other means of funding their health care expenditures, such as raising money through GoFundMe. In over 8 years of existence, the crowdfunding website has raised over $5 billion in donations. Both Cutler and Zassi agree with that sentiment. It's not working for people the way it should, does it? Cutler said. There's no reason why people should have to worry about an illness that's going to put them into bankruptcy. While it's easy to place the blame on one singular entity, it's not that simple. We have a system of health care that has a lot of support from the government, Zassi said. We have things like Medicare, Medicaid, children's insurance programs supported through the ASAI, so there's a lot of government involved in health care. He added that there are also things like government-granted patents for pharmaceutical companies and device manufacturers, so a lot of this is the result of the government's involvement in health care, and the federal government needs to step in and address it. 2 months ago, executives from some of the biggest pharmaceutical companies faced a congressional hearing, as they were grilled on their high drug prices. Senator Chuck Grassley, D. New York, and Amy Klobuchar, DMN, have introduced bills aiming to lower the cost of these drugs. At the same time, he stressed, part of the blame is absolutely also with the industry. We have to acknowledge that the men and women who are leading the healthcare sector, the doctors, nurses, CEOs, CFO, are reacting to economic signals. They're reacting to the ability they have to operate within the healthcare market. We have to understand some of the incentives are pretty perverse. According to the Organization for Economic Cooperation and Development, prescription drugs accounted for 17% of all healthcare costs in the U.S. in 2015. Average costs per person each year are about $1,200 per person, NewsPulse Finance previously reported, and Commonwealth Foundation stated that share is expected to rise over the next decade as drug costs outpace those of all other healthcare services. Cutler described healthcare markets as unsure. If you tell me at the moment of life and death I can charge you whatever I want, then I'll charge you a lot of money, he said. Those markets are unsure. They're not designed to be very efficient. They're not designed to lower cost to people. Isasi noted that the U.S. has done a pretty good job of figuring out where people should be getting better care, but prices of healthcare continue to balloon because of things like pharmaceuticals and the consolidation of hospitals and health systems. We've got a lot less competition, so when you see competition dropping, you see prices going up, and again, the government needs to step in, he added. The public wants this. Democrats, Republicans. Follow NewsPulse Finance on Twitter, Facebook, Instagram, Flipboard, Smart News, LinkedIn, YouTube, and Reddit.